If you're new to my channel, my name's Dr. Tom Walters and I'm an orthopedic physical therapist. When we think about swelling in the knee, this is something that people tell me about regularly when they come to physical therapy. They'll have bouts where their knee swells up and then it kind of gets better, and it does this periodically from time to time. So when people notice swelling that's sort of isolated to the knee joint, usually it has to do with structures inside the knee. We call these intra-articular structures. So it may be that you had a meniscus injury in the past, maybe you have a meniscus tear that can cause swelling inside the joint. Sometimes it can be early arthritic changes, so breakdown of the articular cartilage, and that can cause swelling. So when we're thinking about these things, we want to work on reducing swelling, and so this will be a combination of sort of gentle mobility exercises. Often using heat can be helpful, so you might apply a heat pack. Sometimes getting in a hot tub or a jacuzzi can help to move some of that swelling out and promote blood flow. Also elevating your limbs. So if you have knee swelling, I'd encourage you to lay down and prop pillows up and try to get your foot above your heart using gravity to help pull that fluid back towards your heart. So you obviously wouldn't be holding it like I am here. You'd have it resting up with stacked pillows or something like that. So those are just some early strategies you can add in. I'll now show you some exercises from a physical therapy standpoint that can help. For the first exercise, we're going to perform something called a heel slide, which is a basic knee mobility exercise that's going to take the knee through flexion and extension. Mobility like this, gentle movements can be really helpful in terms of getting blood flow into the knee joint and helping to get some of that swelling out. So what you're going to do, I'm going to pretend like my knee joint has the swelling. I'm going to sit on the ground or on an elevated surface like this. Could be your bed or something that gets you up off the ground. What you're going to do is just kind of sit with your arms behind you, and you're just going to slide your knee in until you hit a point of discomfort. Usually when the knee joint is swollen, people will hit a point where it feels kind of tight and uncomfortable. So just go to that point, and then you're just going to go in and out like that, just repetitively back and forth for maybe 15 or 20 reps. And this is something you would want to do every day, and maybe do 4 to 5 times each day. Again, just to kind of help pump the knee joint, help to get that mobility going, blood flow into the area, and to help remove some of that swelling from the knee joint. So over time, just see if you can bend farther. As the swelling clears, you should be able to bend farther and farther. You may even need to use your arm to kind of help as you get in there, and you're able to bend farther and farther up to full range of motion, which is 135 to 145 degrees of flexion, and then full extension where we can get the knee all the way straight. So just work on this each day, going back and forth. This is one of the most important exercises for getting rid of swelling. Our next exercise will be one that will help activate our quadricep muscles, which are on the front of the thigh. When people have a swollen knee, we often see that they have a hard time activating their quads. This is something called arthrogenic inhibition. It basically means that joint pain and swelling inhibits the quadricep muscle. So this happens a lot after ligament injuries, ACL injuries, things like that, meniscus tears after surgery. So in physical therapy, in the beginning, we spend a lot of time working on mobility with the first exercise, and then the next step is getting the quads activated. So what you want to do is sit like this with your leg out straight, and what you're going to do is an isometric contraction where you're squeezing your quad muscles. So you're squeezing them like this, thinking about pushing your knee down into the surface, whether you're on a floor or up on your bed. Push down, squeeze your quads. You're going to hold for as strong as you can for 10 seconds, really thinking about getting your nervous system activated to turn on those muscles. Don't worry if you can't squeeze them a lot right away. Sometimes people even kind of flutter, things like this will happen. They can't turn them on a lot. Just keep working on it. As the days go by, you'll get better and better at getting those quads re-engaged, sort of getting them back online. So you're going to hold for 10 seconds and then relax for maybe 30 seconds. And I want you to perform 5 to 10 repetitions of this every day. We just come in here, squeeze as strong as you can. If you hit a point of pain, it's okay to squeeze a little bit lighter, but just squeeze as strong as you can. Really try to look at the muscle and improve that mind-muscle connection. Try not to be distracted. Don't be talking to people. Don't be looking at your phone or watching TV. Just look at the muscle. We have research showing that when you look at it and think about it, you can help to improve the neuromuscular control, okay? So that is our second exercise. It's called the quad set. For our last exercise, we're gonna perform something called a prone hamstring curl. This is a really easy, nice strengthening exercise for the hamstring muscles, but it's also good because it takes the knee joint through a wide range of motion and can help clear swelling. So what you're gonna do is lie on your bed, and you're gonna be stomach down, that's the prone position, and then you're gonna scoot down so that your kneecaps are hanging off the edge of your bed. This will be more comfortable. It won't put pressure on your kneecap. You can keep the other leg bent, the one that you're not working. And then what you're gonna do is start with your knee straight on the side that's swollen. And you're just gonna bend it all the way up as far as you can, and then back down nice and slow. So our hamstring muscles are contracting to bend our knee. They are knee flexor muscles, so they contract concentrically on the way up, and then they will contract eccentrically on the way down. So really control that downward movement, and then repeat like that. So this is something, because it's real low load, you can do something around 15 to 20 reps and think about 4 to 5 sets of this each day. Again, we're primarily doing this to activate the muscles and to clear swelling, so it's not a heavy strengthening exercise. The other nice thing about this exercise is that when your foot is up like this, gravity is working to pull the swelling down away from your ankle and foot towards your knee joint. So we want to get that swelling to move up the leg towards the heart. So this is kind of a nice one in terms of the position and how gravity can help pull that swelling back closer to the heart. So again, just think about 15 to 20 reps, moving nice and slow, and 4 to 5 sets of this each day. Thanks for checking out today's video. I hope these exercises help you. If you need a more comprehensive program, I would encourage you to check out my book and my app. The book has programs for all the most common conditions broken down by body region. If we go to the knee chapter, I would recommend using this osteoarthritis program, again, because many people with arthritis get recurrent knee swelling. And so all of the programs in my book take you through 3 phases and have pictures of me doing the exercises. They are much more comprehensive programs than what you would get from watching just one YouTube video. So again, the book has comprehensive programs for the whole body. And then if you'd rather have the programs on your phone, I have a new app, and the app is broken down by body region, just like the book. So you can go through all the different body regions. If we scroll down to the knee and go over, we'll see that there is an arthritis program right here, knee arthritis. And then it has videos of me performing all the exercises with cues on how to perform each exercise. Inside the app, you can also message me. There's a community feature and a chat feature. So you can come in here and engage with me a little bit more if you need more help. I will put links for both of these resources down in the description. Thanks again for watching today's video. I'll see you in the next one. Bye.